Hello and welcome to the first episode of the Frontline series of WeShare podcasts, brought to you by WeShare.Healthcare. WeShare.Healthcare is a newly formed collaborative of not-for-profit NHS medical professionals with the aim of sharing innovation and best practice. My name is Ryan. I'm a final year medical student at Oxford University with an interest in how we can use innovation and tech to identify and overcome problems in healthcare. So we're lucky enough to be joined today by Rachel, an NHS anaesthetist and founder of the CARDMEDIC initiative. Thanks very much, Rachel, for your time and agreeing to be our first guest. It's great to have you on the show.
Pleasure and honour. Thank you for having me.
So I think it's best to just jump straight in with an overview about CARDMEDIC, what the problem you identified was. How did you feel that need with the solution? How is CARDMEDIC being used on the COVID frontline?
Yeah, so I'm currently on maternity leave and was trying, well, my initial instinct was to get straight back to work, but for various reasons I haven't been able to do that. But I was desperate to do something to help, so I was keeping up to date with friends on the front line and reading the news every day, and I came across an article about a patient who'd been to intensive care with coronavirus. It sounds like he'd had some non-invasive ventilation, and he described feeling terrified when he couldn't understand what the frontline healthcare professionals were saying to him through the PPE. So I thought about there must be a way to overcome this, and based on my experience in anaesthetics and critical care, sometimes we write notes on pieces of paper. We have communication boards speech and language therapists use, but writing notes on pieces of paper isn't for the global problem at the moment, and the fact that until there's a vaccine found, people are going to be wearing PPE for the foreseeable future. Writing stuff on paper isn't going to overcome that issue globally. So I thought about maybe having a digital solution, and I asked around with some friends and colleagues and various faculty groups to see whether this exists. Was there a sort of A to Z list of topics that staff might want to talk to patients about? Was it available online, easily available? And it didn't exist in the format I was thinking. So I just thought about what I would want to speak to patients about or need to speak to patients about under these circumstances, whether that's to do with management, investigations, procedures, certain aspects of their care. And I wrote a load of content for that, put it in an A to Z list, and then within 72 hours, we launched CARDMEDIC.com. And my husband runs an e-commerce business, and with his kind of tech mind, he was able to help me do that and launch that. So yeah, it kind of went from there really. So it's really just to try and improve communication through that PPE barrier.
Brilliant. Well, yeah, I mean, it sounds like a brilliant initiative. I had a look at it online as well. And the work you're doing, I think, is absolutely fantastic. You've touched on it briefly. You mentioned your husband working in the e-commerce business. What were the first steps really that you took in your journey to turning CARDMEDIC from this idea that you had reading about the patient online to an actual tangible entity? Did you have to collaborate with anyone in particular, particularly in the sort of tech sector?
Yeah, so it's definitely been a team effort, and people have donated their time and their services to pull this together, because I've pretty much done everything without funding. So from the tech side, my husband researched various platforms, and we initially went with Squarespace. And he was able to do all the kind of design work around that and upload the content initially. And it's been translated into 10 languages. So we had Weglo donate that service for us. We've since had Language Connect do it professionally for us, and we've got some volunteers as well helping. Andy Tagg and Jane Stokes have been brilliant in helping coordinate that. We had it human translated, but from the tech point of view, we did have to integrate machine translations. And then for patients that are unable to read for any reason, whether it's they're partially sighted or blind, whether they've got literacy problems, whether they're just too unwell to read, there's also a sight speaking function. So Sight Speaker donated that. So we had to integrate that into the site. So those are kind of the initial tech bits. And then we had a developer who's worked, Phil at A Million Monkeys, worked tirelessly to create an app out of this. So we've got a free app as well on Google and Apple. So yeah, to integrate a kind of back-end content managed system that speaks both to the website and to the app. He's used Laravel and React Native as the platform for that. So at the moment we're just working on various iterations of that. We have the ability on the app to upload your name and photo, your job and where you work, if you want to be able to show the patient who's looking after them behind the mask. So that's had some development involved. And then we've also got a free text section where the patients and staff can communicate either through dictating, so speech to text, or just typing messages to each other. And that can be auto-translated in the app as well. So we're using Google Translate as the platform for that at the moment. So yeah, so there's kind of bits of technology going into integrating all those features, and we're constantly working on developing that.
Yeah, brilliant. I mean, it sounds like you've pulled together so many teams and coordinated all these different efforts. It must have been quite a task. How long did it take you to, get it on the road? And just from an idea, how long did it take for you to actually develop something that was actually usable?
Well, within 72 hours, we'd had it launched as a website. And then within 10 days, the app was launched. And then through that, it's just evolved. That was on the 1st of April. So within 3 weeks, we had 8,000 users in 50 countries. And then we had some media coverage and a bit of a surge. And then things kind of calmed down again after a week or two. So now we've got over 30,000 users in over 100 countries. And the app has had over 11,500 downloads.
That's incredible.
So yeah, it's been busy, and it's a bit quieter as there's less patients, but with the potential for a second wave, it may well pick up again. So yeah, it's just within 8 weeks gone from nothing to being a 20-hour-a-day project. 7 days.
Yeah. Where did it first start off? Was there did you start off in the NHS, or did you target a healthcare system somewhere else? You mentioned over 100 countries. Where is there a sort of hot spot where CARDMEDIC's being used at the moment?
Yeah, so at the moment it's primarily in the UK. Well, 60% of users are in the UK, and then 15% are in America, and then the remainder are mostly Australia and then Europe after that. We haven't targeted anywhere specifically. This has all kind of grown organically through word of mouth and through Twitter. So I was encouraged by a friend, Rob Galloway, to join Twitter, and just through there it really kind of snowballed.
Just kicked off. Yeah,
it did. And we've I've had lots and lots of feedback from people in various different trusts, but kind of across the UK, across the world, patients, members of staff, members of the public, saying how they're finding it useful in various settings. And I've got I've got an idea of where it's being used, but it's hard to track through analytics exactly which hospitals are involved. But there are across the UK a large number of hospitals that have staff in them that are using it. So the next stage is to try and develop it into a really useful tool for after the pandemic, and be speaking to hospital trusts about integrating it into their systems, their communication systems.
Yeah, absolutely. That's half the trouble, isn't it? Keeping it going after all this settles down. We'll touch on that a bit later. I can imagine people having these ideas across the country, across the world really, might be put off by setting up their own initiatives by some of the roadblocks that they might come across within the first weeks to months of this process. Is there one that sticks out in your mind where it was almost a brick wall essentially that you had to push through, and how did you do that?
That's a really good question. I think it's so difficult because it's only been going 8 weeks. So at the moment, I've just been completely reliant on personal contacts or people just getting in touch, offering to help. I've had people help writing the content. University of Brighton have been fantastic. Patient Safety Learning Group have been really supportive, and the Department for International Trade have been really, really helpful with putting me in contact with various organisations that can help as well. And there's so many more people. I know there's not enough time to mention everybody, but I think just through those contacts, it's helped kind of pull it together, and being in the pandemic, and just in a way a lot of walls have come down, a lot of red tape has is not there at the moment. I obviously haven't done this previously, so I don't know what it was like before, but I know it often takes a long time to get things approved or get things up and running, but everything's happened so quickly. I've almost been running before I can even walk with this. So I'm now backpedaling a little bit, trying to, organize it and really create some structure to move forward to make it sustainable. I think my biggest challenges are funding. At the moment there's almost no funding. My Department of Anaesthetics at Brighton, where I work, have been amazing and covered some of the startup costs. And there was a private donor that covered version 1 of the app. The University of Brighton have managed to pull some funding together to help with a bit more of the development. But I mean, really, that's a huge challenge in the coming months. I'm not quite sure because there are running costs involved, and it has to be sustainable. And there has to be some kind of revenue to keep it running. So I think that's the biggest roadblock at the moment. And also trying to work out who to speak to in NHS trusts about its introduction, what's the procurement process, kind of working through that side of things. So at the moment, there's nothing that's stopped me as such, but there are things that are definite roadblocks in the very near future. With funding and manpower, and trying to figure out how to get it into the NHS in a meaningful way.
Thank you. And sort of launching from that, you said one of the upcoming challenges is going to be getting in touch with people, for right people at certain trusts. If a trust or a certain unit wanted to implement CARDMEDIC and getting up and running in on COVID hot wards, for example, how would you go about getting them to do that? What advice would you give?
Well, certainly get in touch. I'd be really keen to have a chat with them. They can just I'm on Twitter at CARDMEDIC, or they can email info@cardmedic.com to get in touch. But it's, currently it's a free resource, and the most important thing is it stays free for the end user. So it can just be used on a website. You just visit cardmedic.com and you can scroll through the topics, show the patient the screen, and it's right there ready and available to be used. I think a lot of units have iPads or technology that they can show this or use with patients, or you can visit the App Store and download the app. Again, that's free. So they can just get up and running as it is now, but certainly kind of moving forwards, wanting to build out the content, enhance the accessibility. We're working on integrating sign language videos, simple English illustrations, and photo symbols for patients with underlying communication challenges. So kind of building out all of that side of it will obviously be very relevant for hospital trusts as well, and for a large number of user groups. So I'd be keen just to have a chat with anybody that was keen to use it, and then talk about how it might be relevant for their trust, whether there are certain bits of content that they might find more useful that we could integrate for them and kind of make it a bit bespoke. So there's lots of different aspects that we could talk about. So they could either just start using it or get in touch. And
you mentioned some trusts with hardware. What about trusts that don't have iPads or that kind of tech that's ready at their disposal? Is there a way that they can implement CARDMEDIC as well?
Yeah, so you can download the PDFs as well. So they could be printed. The cards could be printed, which is another option. It's obviously not as user-friendly as digital, because you'd need to scroll through the A to Z topics to find them. But you can certainly print out the ones that you might use most frequently to show patients. So yeah, there are other options.
Sure. Yeah. And do you have a favourite topic?
Yeah, so airway is probably one of my favorites. So yeah, I think I've had a huge amount of help with the end of life care section. Catherine Mannix came forward, Lucy Selman, and Ruth Parry, Charlotte Eade, and a really kind of professional team came together to really make that section strong. And so I think that is this, after airway, that's the second most looked at section, almost on par with airway.
Okay.
So, yeah, I think that's certainly in terms of content, I think that's a really powerful section. The obstetric section, I've had help from some amazing midwives and obstetricians.
Oh, wonderful. Yeah.
With that as well. So yeah, that's a big section. There's more to come with that. So yeah, there's so much more content to add, and I have got a load more waiting already. We're just trying to smooth out some of the technology bits and pieces, and then I can add some more content.
Okay, and how do you go about finding these people to write the content? Because it sounds quite multidisciplinary.
Yeah, definitely. It has been. I've had a lot of help from various different people, including, well, Emma Richardson. She was a critical care nurse at Brighton, came at the very beginning within the first few days. And she just got in contact with me to help. And she was amazing. And it's just been through word of mouth, people getting in contact on Twitter, emailing, offering to help, friends of friends. So it's kind of just been through just the goodwill of so many people, mostly getting in contact with me, offering to help, or people providing feedback through the website, members of the public, for example, or members of staff I've not met before, making suggestions. And then I've said, well, would you mind maybe helping writing some of that content, because it's not my area. So people have written some bits and pieces, sent them through on a Word document, and then I've edited them and put them on the site. Okay, So yeah, it's been a team effort for sure.
So aside from content creation, we've mentioned funding as well. What else does CARDMEDIC need at the moment in order to progress from where it is?
So we need to figure out a revenue stream somehow to make it sustainable, and we need to figure out who do we speak to in the NHS to work out the path into, and I know that it's a long process, and I'm certainly not in it to make money from the NHS. I'm very passionate about the NHS. I really care deeply about its ability to look after patients, but at the same time, there are running costs involved. So a certain amount of money to be spent by trusts to help keep this up and running as a really valuable tool is really necessary. So to be able to just speak to the right people and learn that process, I'm actually really grateful to have been accepted onto the Hill Accelerator program run by Oxford University. Yeah, Hospitals NHS Trust and the university as well. So I'm hoping through that process we can get a bit more of a clue about that side of things. And the Department for International Trade have also put us on their global health export offer as well. So that will enable us to have a more global platform. So that's the kind of next steps for us.
Yeah, so there's lots of opportunity for people to get involved who might be listening to this. How do you see the future of CARDMEDIC after the dust settles from all of this?
Well, I see it working as a flexible communication tool that's immediately available at the user's fingertips, essentially, as either a website or an app that's free to use. So it responds to a variety of communication needs, whether that's overcoming a translation language barrier, whether it's for deaf or hard of hearing patients, visually impaired patients, or those with underlying cognitive impairment, whether that's stroke or dementia, or learning disabilities, autism, ADHD, dysphasia, anything like that, that it has pre-written content that's already translated and easily available and accessible for patients to communicate, patients and staff to communicate with each other, as well as providing that integrated translation option as well to try and overcome the language barrier, because there is often many an occasion where an interpreter or translator would be really helpful in a given scenario, but is difficult to find for whatever reason, whether that's time constraints, whether it's financial, organizational, logistics. There is not a shift goes by where I don't think, I could have really done with someone today to help interpret, and relying on, friends and family, or pulling in members of staff from the wards, or from recovery, for example, where I'm in theatres. It's not the best. It's the way that is often done, but it's not necessarily the best or the right thing to do for the patients. So it's just to help bridge that gap as well.
So finally, taking all that into mind, everything we talked about, what advice do you have for fellow innovators, either in industry or on the front line like yourself, on, say, getting started on creating their idea or implementing it into where they are now, or embedding it into the wider system? What would you say is the number one thing?
I think probably the number one thing for me has been that I haven't, to this point, worried too much about the what are the barriers to it all. I've just done it, and I've just reached out and got into contact with people and asked for could they donate services or whatever it is, and just not worried too much about it. And I think that's been facilitated by the lack of barriers present at the moment in the pandemic. So there's a lot that's come together, but I think that's sort of helped just to not overthink it too much. If you've got an idea, just start it. I think if I'd have had 6 months, or if I'd have had time to plan doing this, I probably would have spent 6 months or a year organising it all and planning it all out and having spreadsheets and and everything prepared. But because I just didn't have that opportunity, and I didn't think it was going to evolve in the way it has, I didn't have all that time to prepare. I just got on and did it, and I think that's really helped to get it this far. And it's certainly, just to not worry too much about all the kind of business logistics side, just to get something out there to help. And then it's now trying to kind of unpick it a bit and reorganize and restructure.
Yeah, great. Well, thanks so much for coming on, Rachel. It's been really great to have you join us, and it's been a pleasure to hear your fantastic insights. And well, I wish you all the best with the project.
Thank you so much for having me. I really appreciate your time, and best of luck with doing the podcast series.
Yeah, thank you. Cheers.
We are WeShare.Healthcare. Share big, share quick, share now.